Welcome to session 2 of AYA Power. This is the highlights from the session Disparities in Adolescent and Young Adult Cancer Care and Outcomes. There are many disparities in AYA survival outcomes starting from very early on in diagnosis and treatment. While 5-year overall survival has improved to 85% for the overall AYA cancer population, survival has remained stagnant for a few specific diagnoses, including CNS tumors, many sarcomas, as well as for many patients with colorectal cancer. AYAs are more likely to present with higher stage disease and are at increased risk of dying within 2 months of diagnosis. There are sociodemographic disparities in survival that have persisted for many decades. These data from the Texas Cancer Registry clearly show that patients who are non-Hispanic Black or Hispanic and those patients from lower socioeconomic statuses have poorer survival compared with patients who are non-Hispanic White and those who have higher resources respectively. Unfortunately, these disparities have not closed in terms of the gap over the past 30 years. There are also disparities in survival by setting of cancer care. AYAs are treated both in the community oncology setting as well as in the academic medical center setting. Prior studies have shown that AYAs with ALL, acute lymphoblastic leukemia, and those with central nervous system tumors, as well as those with sarcomas, have higher survival rates if they're treated at an academic center compared to a community site. The reasons for these disparities are not completely known and are still being studied. One of the challenges that the AYA oncology field faces is the lack of patients who participate on cancer clinical trials. These trials are how we make progress. However, you could see on this slide here that there is a valley in AYA cancer clinical trial enrollment as you get into the late teenage years and the early 20s. This prevents our ability to obtain biospecimens, identify novel targets, and ultimately prevents us from being able to identify the most effective treatment for our patients. AYAs also face disparities in their health-related quality of life. Being an adolescent or young adult, patients face many different challenges in their everyday lives, and cancer interrupts many, if not most, of these domains. These may include family building, nutrition, cancer genetics, relationships, body image, as well as a host of others. Fertility preservation is also a major issue for our patients. Many of our patients undergoing cancer treatment are at higher risk for not being able to have biologic children after their treatment. We do have the ability to preserve fertility for many of our AYAs. However, few AYAs ever receive counseling prior to the start of their treatment. Even fewer AYAs actually undergo sperm banking, or for females, fewer undergo oocyte and embryo preservation or ovarian tissue preservation. There are many barriers that prevent AYAs from receiving this care, and this has led to a long history of many disparities in access to fertility preservation. We talked a little bit about the short-term disparities in health outcomes. There's also long-term disparities in health outcomes for AYAs. This is data from the MD Anderson Tumor Registry, which clearly shows that survivors of AYA cancer, or long-term survivors, continue to have inferior long-term survival compared to the predicted survival of the US population. At 20 years after cancer diagnosis, we see that another 30% of our AYA survivors have succumbed either to their disease initially or to long-term or late side effects of their treatment, including cardiotoxicity, pulmonary toxicity, or renal failure. We do see a bright side here that overall survival by decade has improved over the past 3 decades. However, it is unclear whether the number and diversity of late effects will decrease with some of our newer agents, in which we're not that clear about what the late effects are yet. Chronic health conditions are very common in our survivors of AYA cancer. They have a much higher risk and rate of developing multiple chronic health conditions compared to siblings and peers who never had a cancer diagnosis. There's also an increased risk of death due to these chronic health conditions, and we know that patients from minoritized backgrounds have a much higher rate of developing chronic health conditions, as well as developing severe and life-threatening chronic health conditions such as cardiovascular disease. There are many opportunities to improve the long-term health and survival of our AYAs. Unfortunately, most of our AYAs never receive any survivorship-directed care. It is essential that AYA cancer survivors receive screening and prevention and treatment for the chronic late side effects that they incur due to their prior treatment. They are also at higher risk for secondary and subsequent malignancies, and cancer prevention for this population is extremely important. We need to increase access to survivorship care for all AYA cancer survivors at risk for developing chronic health conditions and at risk for early mortality. In conclusion, the AYA cancer community has made a lot of progress over the past few decades. However, there are many subpopulations of AYAs who still face disparities in their short and long-term survival. Patients also experience disparities in the delivery of their cancer care at diagnosis, during treatment, and long after treatment. We saw that AYAs present with higher stage disease, they're more likely to die within 2 months of diagnosis, and their 5-year overall survival and long-term survival is still poorer compared to what we would hope. There are many opportunities to improve the care for AYAs throughout the cancer continuum, and we need both local and national efforts to do so to improve care, health-related quality of life, and survival for all AYAs diagnosed with cancer.